You are watching the Doctalk show.
In our future story today,
so we noticed that she couldn't make the sounds that babies make. So we got concerned and we went back to her PID, who recommended us to carry out a particular test to see whether I was exposed to rubella while pregnant with her. And it was confirmed that I had been exposed to rubella, which affected her cochlea. So that's why she could not hear.
Try to read about it, to try and understand it. And fortunately, we're introduced to some people who had similar challenges and had been able to, to look at options like the cochlear implants. Communication has like a key role in terms of engaging with an individual. It doesn't matter whether it's an adult or a child. So there were aspects which would be slightly frustrating, especially at an age where you really want to deal with the verbal communication aspects, whether it's on matters of discipline or on matters of education. But also it wasn't just us as adults, but also having two older siblings who are trying to pass on the same kind of, whether it's games or the kind of rhymes that they enjoy having. So it had its challenges, at both levels. So as an adult, you face the frustration both from your own communication, but also from seeing the disconnect between, your children.
Yes, we were introduced to Mr. Eddie Mukaya of Hear His Voice Uganda, and we started the journey.
I think in the very beginning, because, back then when we met Eddie, like the opportunities to do cochlear implants in Uganda had not yet, the opportunity existed, but there's still elite challenges around, whether it's therapy. So there were aspects around, yes, this is possible, but it's not complete. So I think in the beginning it was an introduction, but one to tell us that the process you wish to undertake cannot be undertaken in its completeness here in Uganda at that point.
Excited, hopeful. Yeah, the future is bright for Ivanka. Yes.
Yeah, hopeful.
Well, for parents out there who have children who have hearing impairments, the first thing to do is to accept it and then start seeking solutions and looking at the different options that are available, to make sure that you do your very best that you can to see that your child has a brighter future.
Right now there are available resources both in terms of persons but also in terms of knowledge. So parents have access to other parents who are able to share some of these stories and the kind of solutions they've been able to take. And so one of the aspects would be to seek out that kind of information so they're able to make informed decisions. And at the same time, of course, we'd like to thank TMR Hospital and also thank Professor Roland and his team for having carried out this cochlear implant for our daughter.
You are watching the Doctalk show. You are watching the Doctalk show.
Welcome back. I'm with a team of ENT surgeons at the TMR International Hospital, and we are discussing deafness in general. And shortly after, we shall discuss interventions that are carried out at this hospital and elsewhere to correct deafness. So more about deafness and who might be at risk of becoming deaf. Dr. Chris, in your practice, which people have you observed might be at risk of having deaf children? Or I don't know if that question is very clear. People at risk of getting deaf.
Anyone is at risk of getting deaf.
Anyone?
Yes, anyone. Like we said before, you can acquire it or you can be born with it. Okay?
So I think in the acquired cause, I think what would be the biggest causes you've seen?
The biggest causes currently in Uganda are ototoxic drugs.
The drugs.
The drugs we use to treat people. Some of them do destroy the ears, and for example, some of the anti-TB drugs, some of the chemotherapeutic drugs, commonly antimalarials, those kind of drugs normally have an effect on the ear, and sometimes they just shut the ear down.
Okay, so people have to be careful about the drugs they take. They ask their doctors, will this drug make me go deaf?
It is not about being careful, it is about the health worker knowing that some drugs may cause.
Okay.
And I think we are trying to do, but you see, disease burden is disease burden. Yeah, you may test the patient before you start the treatment, but along the way they get some kind.
Okay.
Or most of them never get tested, then along the way get some kind of hearing loss. Remember, hearing loss starts from mild to severe or profound till deafness. So there's that group of drug use or drugs, ototoxic drugs causing getting people at risk or getting acquired hearing loss.
Acquired hearing loss, yeah?
Yes.
Okay.
Then,
so drugs, is there anything else you'd worry about?
yes, noise.
Noise.
Yes.
Okay.
It's a very big category.
And many people like using earphones. So are earphones dangerous? Will they cause deafness?
Yes, for a long time, loud noise in the ear will definitely get you into trouble. Okay, so the youth and people who use those gadgets should know that after a certain period of time, you are exposing your ear to some kind of hearing problems, and you may end up in either profound or severe hearing loss.
Okay.
But also people who work in factories, like people who work at the airports, people who work in noise areas.
Generally where there's a lot of noise.
Yes,
that
they need
exposes the
protection.
ears.
And sometimes they are not protected, they are exposed to this noise, and this causes problems to them later in life.
Okay,
Yes.
so Dr. Sean, reflecting on the burden of deafness, what you've observed here as a visiting doctor and back from where you come from, what's the picture like?
Well, I think you can think about the burden of deafness in terms of the patient, the individual patient, the family unit in terms of a child, or the greater society. And I think one thing we've noticed here, and we want to try and change that with newborn screening, which is very important, is we want to lower the age of the identification of the hearing loss, especially in children that are born deaf or lose their hearing shortly after birth. Right now it's too old here, and we want to help institute.
Like how old? What do you mean it's too old?
Well, you might think of a 3-year-old or a 4-year-old still as a very young child, but we know that the central nervous system begins to unlearn how to hear if it's not stimulated. So in the United States at NYU, where we have a very large cochlear implant program, we implant children under 1 year of age very frequently, all the time.
So you do early identification and early treatment.
Early
within 1 year.
identification is very important, and the second part of that is early treatment, whether it's hearing aids or cochlear implants. Not every child needs a cochlear implant. Some can do perfectly fine with hearing aids, but we need to identify it early and we need to treat it early.
What would happen if the child, for example, reaches 5-10 years and the deafness wasn't identified? What would happen to them?
Well, we looked at that as an opportunity lost. Children that are untreated will never learn to speak. They won't educate at the same level as their normal hearing children. They typically will be underemployed, undereducated. They will not be productive tax-paying citizens to the extent that their normal hearing peers will be. So we want to change that paradigm. We want to identify this early and intervene early, because that early intervention at a year or even a year and a half or 2 years is so much better than 3 or 4 or 5 or 6.
So the child can be able to grow up to become like any other person who has normal hearing.
Yeah, if you implant a child at 1 year old, for example, by 2 years of age, they will have normal speech. They will speak just like their normal hearing counterparts. And if they have long hair, for instance, on a girl, you will not be able to tell that they're deaf.
Okay.
It's amazing technology. As far as the three of us, I think we can unequivocally say It's the happiest surgery that we do in our practice. Changes lives.
One of the things, the most common thing we see is late onset of language development, late onset of speech. By a year old, most children have a couple of words, or 12 words, or 15 words, and these children don't develop a language or speech. Now, some children have normal hearing, just have delayed speech onset, but that's one of the common things. Responsiveness to noise. You know, you call their name, they're playing in the corner with their toys, and you call their name and they don't respond. Some might think, well, that my child's just a little bit stubborn and he wants to keep playing with his toys and he's not responding.
Usually, what age do they start to recognize that you're calling their name?
Oh, very early on. I happen to have a 7-month-old granddaughter right now, and I could call her name at 3 months and she would sort of start looking in that direction. I mean, so children start to respond early.
So usually by 3 to 6 months, they should show signs that
Of
they're
responding
hearing.
to sounds. Maybe they won't recognize their name just yet, but many do. And other things, just a general auditory awareness. They just don't seem to be as aware of sounds that are going on in the environment around them. You know, a child, a 1-year-old or 2-year-old may hear a bird singing and will look for the bird, whereas a deaf child may not do those things. So parents will have a suspicion that they're just not responding to environmental sound and like other children would.
Okay.
Sometimes you could have, even in some of the genetic causes, only in the recessive genetic causes, only 1 in 4, about 25% of your children are deaf. So you could have 3 normal hearing kids. And they'll say, well, this kid just is not progressing at the rate the other ones did. Maybe I should go get their hearing tested. I think there's any suspicion at all, getting good quality hearing testing. Now, we can screen children at birth with a special kind of test to know it, to be pretty sure if their hearing is normal or not.
Okay.
And then
So,
further workup should ensue if it's not normal.
so how is that hearing testing? How is it done?
You go in and
the
you put
hospital.
a little earbud in each ear and you perform a special kind of test. It's called otoacoustic emission or auditory brainstem response. The otoacoustic emission takes about 18 seconds and the brainstem response probably takes about 20-30 minutes. And you can pretty much tell the hearing level of a newborn.
Okay.
And we like that because then we can start thinking about how severe is their hearing loss. Can we treat them with just hearing aids? Or do we need to go and start talking about cochlear implants earlier so we can lower that age of cochlear implantation? I don't want to say it's wrong to have for a 4-year-old or 5-year-old or 6-year-old have a
But you're
cochlear
advocating
implant.
that the earlier they do it, the better.
The earlier they do it, the faster they'll take off, the faster language. It's
Okay.
not wrong to give a 6-year-old a cochlear implant, but then a lot of hard work has to happen so that they can learn to make sense out of this new sound and their brain will start to develop language.
Okay. So as we conclude this segment, Dr. Chris, is this screening of the newborns, is it routinely done in Uganda or it is something yet to be implemented?
It's not done routinely. You're a doctor, you should know that we don't screen routinely.
Because we don't know if it's part of the like antenatal package or something.
It's not part of the antenatal package. But there are few screening centers in the country. If you need your child to be screened, there are few screening centers in the country. And this is not new. When I was still a resident, I did that as my thesis. And that's about 13, 14 years ago. So
Okay.
So
there are some places where we
some
can.
places where you can have these screenings done.
Okay, so we'll come back to more to that shortly because they're now going for a break. But more about the screening for newborns, in case you're interested, if you want to know if your child has maybe an hearing impairment, there are some centers which I'll talk about in the upcoming minutes. Remember, you can send in your questions and comments on our social media platforms. We're at TMR Hospital, right here at this in the outskirts of Kampala.
You are watching the Doctalk Show.